Thanks, Kate. Can everybody hear me okay? Great. I'm a pacer. I'll try not to pace too quickly and make you dizzy, but I wouldn't do well behind a podium. So thank you so much to Respecting Choices for giving us the opportunity, or me the opportunity, to present this. I said us because my invisible partner here is my coworker, Teryl Desrochers. She was instrumental in creating this presentation for you today. And also, I have to confess that she and a couple other colleagues, Belinda Ray and Nicola Bombard, were a little more directly involved with this actual project. So I got to watch it unfold and support my colleagues. But I have to confess up front, it's maybe one of my disclosures that I don't have a conflict of interest, but I have not been as directly involved. But I did watch the process unfold and did sit in on some meetings with GE. So I'm not coming completely out of left field. So I don't have any conflicts of interest. And here's what I'm hoping that you'll get out of this session today. We're hoping that you'll see two strategies that you could incorporate into your own internal processes to encourage your own staff and employees where you are to engage in advanced care planning, and then perhaps think about one strategy that you might take out to a community partner to encourage them to give their employees that same opportunity. So I'll give you a little bit of background about how we came to work with GE through this Dartmouth Hitchcock initiative we call Honoring Care Decisions, how we used the funding, the challenge that we faced almost immediately upon getting the grant, and then the key outcomes of the program. So Dartmouth Hitchcock Medical Center is the largest private employer in the state of New Hampshire. We have our main medical center in Lebanon, New Hampshire, and then we have community-based clinics throughout the state. And then we also have a number of other facilities that we're affiliated with by different legal arrangements that are still a mystery to me, one of which is New London Hospital. We have a colleague from New London here today. So we are also, I think, one of the largest healthcare providers in the state as well. I can't remember if the VA beats us in size, but we're definitely one of the largest. And we wanted to kind of see how we were doing as an employer in terms of advanced care planning and the poor shoemaker's kids, right? So we partnered with a group called Rethink Health to do a survey, and our department, Partners in Community Wellness, which has trained a lot of our volunteers to be out in the community, including at employers, was a part of this process as well. And they surveyed Dartmouth Hitchcock as well as a number of other area employers just to kind of see where people were at in those businesses in terms of their own advanced care planning. So of our employees who responded to the survey, we found that there was this sort of classic disconnect. A lot of people were thinking about their wishes and even talking about it with family members, but they weren't taking that final step to get it documented and kind of make it official. We also weren't entirely sure about the quality of those conversations, that they say they talk to their family, but what did that really look like? We couldn't be sure. So we thought we could actually increase the number of employees at Dartmouth who are engaging in advanced care planning. It would help them, and it'll help us because we want all of them to be ambassadors for this process that we're promoting with this Respecting Choices model. As it turned out, GE Healthy Cities was also interested in funding different population health initiatives. They had slightly different goals. They kind of wanted to, put a little extra shine on their image as well, but also really show how a private-public partnership or corporate and healthcare partnership could be effective in moving population health outcomes. So we'd heard of the grant and thought that we could align some of our goals for our own employees with this population health grant that they were offering. So we kind of adjusted our own goal, got a little bit more specific, and we thought if we got that GE grant money, we could use it to engage at least 1,000 of our employees in some form of advanced care planning by the end of 2017. And we saw a potential for collaboration with a company that Dartmouth owned called Imagine Care, which was using technology to encourage wellness. So like at the time, we all had our own little personal Fitbits, and the Imagine Care was pushing us to get so many steps and giving us little rewards here and there. So we thought, great, if they're rewarding us for steps, why not reward them for doing advanced care planning too? So that they got excited about that partnership. So that was kind of the initial intent and what we set out to do. And we actually got the grant, which was terrific. Besides the funding that we got, the other part of the deal was that GE also offered all these different webinars that provided good resources for how we could tell the story of our work, how to better collaborate as a team, collaborate with GE, but also collaborate within our own purview. And so there was a couple of different webinars that we found particularly helpful, which I do reference at the end of my slides, but it was one particularly about collaborating as a team and then also communicating, sort of really telling the story of our project. Those are particularly helpful. So we were lucky enough to receive the $25,000 grant, and a good big bulk of it was going to go to our partnership with Imagine Care, because the other thing we were going to do was actually create an app to do advanced care planning on your smartphone. We were going to test it with our Dartmouth Hitchcock employees so that then Imagine Care could refine it and then actually start selling it to other companies and folks out in the public. So it was sort of a win-win. We were going to provide some incentives, another easy way to do advanced care planning for our employees, and then we're also going to be able to expand our reach a little bit and help Imagine Care do something new and exciting in healthcare and wellness. So a bulk of the funds were going for that. We also wanted to train all the, what they called health navigators in Imagine Care. They were the ones sort of out there with employees, encouraging them to engage in different wellness activities, and train all of those folks in first steps advanced care planning so that they could help us have these conversations in a broader way with all of our employees across the state. And then, of course, we wanted to be able to promote what we were doing, and so we had a little bit of budgeting for that as well. So we wanted to do this as widely as possible, so we needed more partners beyond just Imagine Care. So employee wellness, which was partially obviously associated with Imagine Care, was very important. Our program at Dartmouth is called Live Well, Work Well, and they were kind of helping with some of the incentives behind what people were doing. They do a point system. Unfortunately, those points no longer add up to dollars, but you can collect a nice number of points for doing various Live Well, Work Well activities. Obviously, human resources, and then we're part of population health, so those were other partner organizations within Dartmouth that helped us. And then partners in community wellness helped us not only with our relationship with GE through Nicola Bombard, who we work with at PCW, but she's also got this wonderful cadre of volunteers who are out in the community. And so it was some of those volunteers that helped with the Rethink Health initiative to do that original survey. They're also out in the community doing presentations at different organizations and employers around the region. So they were kind of a secondary effort we made through the grant to do more outreach out in the community. So it wasn't just about us. So this is just to give you a sense of how PCW works. This is sort of generally who they're kind of connecting with out in the community. All right, so we hit a wall, a big wall. Pretty soon after we got the grant, Imagine Care went away. Dartmouth Hitchcock sold it. So our whole dream of creating a magical app that would get everyone doing advanced care planning died. So we had to do something different, and we had to change tactics. And I have to say that there's nothing like hitting a wall to bring out your creativity, right? So we quickly regrouped, and we decided that instead of working with those health navigators from Imagine Care, we would focus in on what's called the wellness ambassadors through Live Well, Work Well. So these are folks who are actually working in every department of Dartmouth, and they're there encouraging people to engage in the Live Well, Work Well activities and kind of get people to do different things. And so what we were trying to have them do is, well, first of all, what we were educating them about honoring care decisions and first steps in particular, we were encouraging them to schedule group conversations. So we would come to a staff meeting, we would give our presentation, we'd feed them yummy food, and then everybody would get a spiffy button that says, ask me about advanced care planning. And so all of a sudden we've got even more advanced care planning ambassadors. So we'd give them a pin to say, thank you very much for coming to this presentation. We gave them a few talking points, which had key messages around advanced care planning, so they would feel more comfortable if someone actually did come up and ask them about advanced care planning. So we were sort of hopefully planting some seeds. So not only equipping them with the information and the chance to have a discussion for their own personal planning, but also feel more comfortable spreading the message and asking the patients that they're encountering if they've done their own planning. And we also, of course, wanted to provide a little bit of incentive to the wellness ambassadors themselves. So part of our budget went to getting gift cards and things like that would help encourage them to schedule these group discussions. And so through just the wellness ambassadors, we were actually able to engage about 700 employees. So we did enough group conversations to almost hit our 1,000 employee goal. But we did more than that. Again, regrouping, getting a little more creative. We went back to Live Well, Work Well. We said, can we build advanced care planning anywhere else in the program? And so they said, great, we'll put you on the website. So this is a part of our Live Well, Work Well website where people can request a one-on-one conversation or a group conversation for their department. They also do a survey of employees, and again, you win points if you fill out the assessment, and they've got several advanced care planning related questions into the assessment. So this is just a screenshot of that. And then we already had an existing e-learning module, again, based on the First Steps language and not so much scripting, because what it does is it demonstrates sort of a quick clinical workflow of how you might introduce advanced care planning and then encourage and refer for a conversation. And it does it from a clinical staff, like a doctor or a nurse practitioner, as well as non-clinical staff, so anyone rooming a patient, anything like that. So it takes them through that. It actually provides a 0.5 CE credit. We cannot mandate this training, unfortunately, but we have plans to sort of get it into the queue of the mandated things so people will just kind of do it along with everything else. That's in the works for the next coming cycle when people have to complete their mandated reporting, their mandated training. And then we also went back to HR and we said, can we do a little bit more to amplify this advanced care planning opportunity we want to give employees? And so we worked with them and through our budgeting actually built advanced care planning into the benefits enrollment portal. So as they're enrolling themselves for healthcare and life insurance and all of those things, they can also sign up for advanced care planning. So that actually really upped our profile quite a bit with our employees. So here are our results to date. As I said, we had over 700 people participate through the Wellness Ambassador Program and group conversations. I ate so much Panera during that time. And then again, we've actually hit our goal of we've had over 1,000 patients engage in some way, either through a one-on-one, a group conversation. We've reached out to over 1,000 patients, employees. And then 500 pluses, these are the number of requests we got for either one-on-one or group conversations through the human resources portal, through the benefits period. And that was just recently. So we actually did hit our goal despite not having a spiffy app, and it actually worked out okay. The other thing we were able to do, because we had some funding left over, and Rebecca Sidori mentioned this earlier, is that we were able to contract with Prepare for Your Care, and this gives us a very specific Dartmouth Hitchcock link, one for employees and one for the public, for actually anybody, but we do send it to patients primarily. And what that does is that gets us the ability to track specifically who's coming from Dartmouth to engage with Prepare for Your Care. We are still figuring out the best ways to promote this website and get it so it's not being used at the rate we would like by patients or by employees. However, we did notice that we had this lovely meeting with our new CEO around National Healthcare Decisions Day in April, and she wrote this great piece in a weekly letter that she sends out by email, and she included this link, and we got a spike of use. So we have a feeling that I'm using a trusted source of information with some authority sort of driving to the site might actually be one of the ways that we could promote this further. So we're still looking for ways to use that because the data we get back is useful. I feel like we could make more of it. So that's something that's definitely been rattling around my head as we've been in this conference. So this is how we ended up using our funds. You remember we had set aside so much for Imagine Care. We ended up using the bulk of it for the build into the HR benefits portal and also for contracting with Prepare for Your Care. We still have almost $6,000 left, so we continue to fulfill those 500 requests for ACP, and of course we can feed people anytime we do a group. We'll continue to use it for promotion. So there's still some funding that we're continue to use. And that is pretty much it. Anyone have any questions? Yeah.
So I think I originally misunderstood the title of your presentation.
Oh.
That you were working with GE employees.
Ah, sorry, that was probably my fault. I think I wrote the title.
Not at all. If there are opportunities to work with employer groups
Mm-hmm.
outside your health system, you kind of alluded to some of the community work, and if that's been something that's been explored.
Yeah, thanks for asking. So we have, I think when we did that Rethink Health, we went back to all of the employers who had participated in the survey, and we said, hey, here's what's going on with your employees. They each got an individualized report, and then we had sort of the regional report. That's how we found out about our own employees. And so out of that, a few companies stepped forward and said, oh, we would like to do a little bit more with advanced care planning as a result. So in some cases, there was one company, Hypotherm, and they actually had people at their work site trained as facilitators, and so they'd been doing one-on-one conversations and even some group conversations on their own. So they kind of took it upon themselves to be their own site for the work. Most of the time what happens is they'll bring us in, so usually facilitators from the PCW will come in and do a group conversation and make themselves available for one-on-one conversations. But that Rethink Health survey was a good kind of starting point for us. Yeah. People often don't realize what's going on with their employees until you take a close look at it, so I think showing them those numbers was very helpful. Everyone's tired, right? Long day.
Just have a couple ideas for Lindsay related to working with employers in the community. And in my experience in Wisconsin, we got some experience, first of all, with our own employees of the Wisconsin Medical Society. So we would tie an employee initiative in with National Healthcare Decisions Day usually, and sometimes have a little contest around it and make it fun. And it was typical at the society to do brown bag lunches periodically on all kinds of subjects. So we just kind of got into the rotation for that. But then other opportunities came up, and one was in our partnership with Wisconsin Public Television to create the video that I think many of you use, which I'm really happy to hear, so people have commented to me. They actually said to us, we are so enamored by this work based on our experience in working with you on this video that we're wondering if you would be willing to come and offer this to our employees. And we said, well, of course we would. So we offered several different group facilitation sessions, but then we also came back at a specific set time for people then to come back again. They didn't need to make an appointment, just to know that there would be several facilitators available to either help them complete their document or talk some more with them. We also encourage them to bring their significant others to the group facilitations if they wished, and that was a neat opportunity. So sometimes looking at the people that you already have relationships with, and either let them know that you'd be willing to do this, and we kind of would portray it as this wonderful benefit that we were bringing to them, which of course we think it is.
Great. We also find that when we're out in companies, I heard this more than once, I am so blown away that my company is giving me time to do this. That that they give them paid lunch hour or whatever it is, but that they allowed this, and it showed to them what a priority it was for the company, and that helped them feel more invested. And we're definitely experimenting with ways to get people to kind of come back and have further conversation or do the documentation. In the state of New Hampshire, we have that the law of next of kin. But live free or die, not everybody wants the state telling them who's going to make their decisions. So we'll often use that as an incentive. If you don't want the state deciding who your medical decision maker is, let's fill that part out right now. But that's, I think, one of the challenges with group work is that sort of follow through. People aren't always ready. So we're trying to figure out different ways. So we've definitely had the same situation where we've come back with a group of facilitators for one-on-one consultations. I've come back and done like a group session where we all fill out the form together. We're trying different ways, seeing what sticks. Yeah.
Did I miss, it's on the employee benefits website?
Yep.
Do they get any special perks?
They get points. Alas, we are not able to offer any financial incentives for any of the Live Well, Work Well activities, but all of it's a free benefit. So they have to help pay for their health care benefits, but they get to do the advanced care planning for free. Sometimes that's an incentive. We wish that we could offer a little bit more. I think when we first started partnering with Live Well, Work Well, they had just stopped paying people for their points that they were earning. So that was a little disappointing to find that out. But some people are motivated by the point system. Roberta.
A couple of things. I'm trying to get this into an activity with employees through HR. We have it we have a My Wellness, same kind of thing. We get paid twice a year, $75 for so many points, and then $50 in a reduction in our health care, medical costs. So, but what I found is we have less than 0.1% of our employees who check the box that they have an advanced directive. So it's a big deal. As I'm doing presentations, I get maybe 10% of our employees saying they have something.
Yeah.
But HR has this, oh, you can't mandate it, and you can't, it's got to all be voluntary. And there's some pushback about, even putting it on the My Wellness portal. So I'm wondering, what's the political strategy you used with HR, and how much pushback did you get? How did you overcome that to demonstrate how important this is for employees as well? And I have to say, in a collaborative that I'm working with, one of the CEOs, we wanted to do this as a collaborative between 5 health systems and get our employees engaged and and one of the CEOs said, our employees are not our patients. I'm only concerned about our patients. And I'm thinking, oh my God, how short-sighted is that? So it's all of that kind of, how do employees get time off to do this? Do you pay them to do this? All of those kinds of questions I have. Maybe we should have a longer conversation, but I thought it might be important.
No, I'm happy to answer some of that. Yeah. We were lucky as I don't think we had too much pushback at the beginning. And some of that might have come back to the survey result, that we could show them, listen, they know what's important, but they're not taking the steps that they need to actually make sure their goals and wishes are honored. So, and there is, I think in general, our culture does honor the fact that in some places they literally are our patients, our employees, because we're like the only game in town. So, so there's a definite connection that Dartmouth Hitchcock feels as an employer as well as a provider to those employees. So we're lucky in that we don't feel a lack of responsibility in that way. In fact, I think that people had been talking to us before we even started to say, your employees are patients too. That's a population we need to pay attention to. So we might have actually been a little behind the game in that way. So there's that. I think that the survey was probably helpful. We also were pretty flexible in how we delivered the conversation. So we even got, but you may want to close your ears, we got the group conversation down to 30 minutes. It's not really a conversation, but it does hit all the points of that first steps interview conversation. So really trying to be flexible in terms of the format. Feeding people really makes a difference. We were asking people to take time off during lunch to do it because we weren't able to do a lot of after-hours stuff, and we were also fitting it into staff meetings too. So I think having that flexibility to say we can format this however it works for your department. It was a lot of meeting people where they were, and then having those partners, those wellness ambassadors, so it wasn't just us coming in from outside a department, it was someone from inside the department initiating this invitation and organizing the event. So we weren't kind of coming in at anybody, we were coming in by invitation. I think that made a difference too.
So I can't tell you what's going to be effective with your CEO, but if you realize that public engagement in general is important, and most health organizations are one of the biggest employers in their region. So Gunderson has 8,000 employees. Just think of the impact the employees have. So, you know, someone at church says to an employee, you guys are doing this Respecting Choices program, what's that about? And the employee says, I don't know. I don't know what that's about. I mean, well, I guess it's not that important, right? I mean, our employees, whether they know it or not, are ambassadors of the programs. I mean, we encourage our employees to not smoke and to exercise, to be good role models. And so I think engaging your own employees in advanced care planning as well as other wellness programs has an impact on the larger community. Everyone goes home and has family, they have friends, they have social relationships, and if you understand anything about social change, it's about thought leaders who affect their network. And I believe, so what we did in the early years of our work is every employee in their orientation program got introduced to advanced care planning. They weren't, you know, saying, you know, we're not going to have an hour of facilitation. It was just a general, like 15 to 20 minute introduction as groups about what we're doing, why we're doing it, and why it's important, and inviting them to participate. So we wanted them to be knowledgeable about this being a priority in the organization, why it was important for families, why we were doing this, and saying, you should think about doing this. And then as they came in for wellness exams, then their doctor can engage them and actually try to get that completed. But I think health systems should really look at this as a community engagement strategy.
Absolutely.
Well, and thank God that comment was not made by our CEO, because our
Right.
CEO is completely behind what we're doing.
Great.
But it is, you know, it's part of that
It's an attitude.
viewpoint.
Yeah, it's an
Part of that
attitude.
viewpoint that all of us have to struggle against in various ways.
Totally. We were just hoping that like more light bulbs would go off the more employees that we engaged, because it's that initial firsthand experience of a first steps conversation where you just see the look in people's eyes before and after. It's just, oh, this is what it's about. I can do this. My mom should totally do this. You know, I would say that the one hill we haven't quite climbed is getting into orientation. It's such an overload of information. They're really reluctant to make any changes. So the benefits portal and that e-learning module being pushed up was sort of our compromise. But someday.
What results did you find with it embedded in orientation? Did you see an increase in?
I don't know that we measured, but you know, we have a fairly high percentage, I think, of employees who do complete it. I can tell you a story where I was doing an ethics consult in bed 1, and a nurse was doing an intake in bed 2, and she got to, do you have an advance directive? You know, I'm not listening to the patient anymore. I'm listening to the nurse ask these questions. And the patient said, no, do you have one? And the nurse said, no, I haven't done mine yet. And the patient said, I guess it's not that important. And that was like, okay, she completely bombed out on it. I mean, the patient just said, I don't need to do this because you haven't done it. And it was just a clear and obvious example about how patients take their, you know, it would have been wonderful if she could have said, yes, I've done mine, because even though I'm younger than you, it's still very important because we never know. And I think then the conversation would have evolved in a completely different way. But it's an anecdotal story, but it makes a lot of sense from a human relational point of view that if our doctors and nurses and other employees don't think this is important and don't know what it's about, they communicate that to the rest of the community. And then your work is just a lot harder.
I have a health coach that I've just trained in a practice, and she said, you know, I don't have one of these, and I'm very afraid of it, but I don't want to be hypocritical with my patients when I'm going to be doing the follow-up. and asking them to do this when I haven't done it myself.
Yeah.
But she has fears about it, and so we ended up talking about what are those fears, but understanding your own is going to help you,
Right.
help patients get through that too.
Right.
Thank you, Jennifer, and don't go away. If you would like to ask more questions, it is a break for 15 minutes, but 3:45 is our last plenary session of today.